This short video has been produced by George Ampat. I work as a consultant orthopedic surgeon at Liverpool in United Kingdom. I'm also an advisor to Orthotics Incorporation worldwide. This video is going to be a short review on plantar fasciitis. My disclosures are as stated previously. I'm a medical advisor to Orthotics Incorporation worldwide, and as part of my work have received grants from Orthotics for research, traveling and speaking. We shall do a short review on plantar fasciitis. Each foot is a complex organ having more than 26 bones. The tibia is the largest bone in the lower leg. The talus is in the center of the foot. The calcaneum is the heel bone. The metatarsal and the phalanges are in the front. The bones are arranged to form an arch. A ligament runs on the base of the foot near the sole of the foot and helps to hold and maintain the lengthwise arch of the foot. Repeated stretching while walking and running can cause repetitive strain injury resulting in pain into the heel of the foot. This is called plantar fasciitis. There is some controversy among scientists whether it should be called plantar fasciitis or plantar fasciosis. The word fasciitis indicates inflammation. However, studies have shown that at the molecular level there is no inflammation and it is only degeneration. Hence the reason why some scientists prefer to call it as plantar fasciosis. The pain in plantar fasciitis is on the inner side of the heel and on the sole of the foot. This general review in the Journal of the American Family Physician states, patients may present with heel pain with their first steps in the morning or after prolonged sitting, and sharp pain with palpation of the medial plantar calcaneum region. As shown in the diagram, pain is on the inner aspect of the heel. Pain is also experienced early in the morning. The first step is very painful. Even during the day, the first step after resting for some length of time can also be painful. The review by Manuel Monteagudo and others talk of the repetitive strain injury that occurs in plantar fasciitis. As a result of taking around 7,000 steps per day, the plantar fascia is injured, victim to a subtle repetition of the damaging longitudinal tension movements. Plantar fasciitis is quite common among sports persons and runners. This review by Lopez and co-workers show that plantar fasciitis is the third commonest running-related injury. The usual treatment for plantar fasciitis is stretching of the plantar fascia. This randomized controlled study showed that a specific plantar fascia stretching exercise is beneficial. Gastrocnemius is one of the muscles in the calf. Tightness of the gastrocnemius also contributes to plantar fasciitis. Part of the stretching program involves stretching the gastrocnemius muscle. Stretching exercises are available at orthotics.com or foot.com. Stretching alone may not provide relief, and many other methods of treatments are available. We will have a look at a few of them. Injecting cortisone or steroids into the inflamed part of the plantar fascia is one such treatment. However, research shows that the injection only provides pain relief for a very short period. This Cochrane review, published in 2017, showed that injections only provide relief for 1 month. The review states, we found low quality evidence that local steroid injections compared with placebo or no treatment may slightly reduce heel pain up to 1 month but not subsequently. Another review published in the Annals of the Royal College of Surgeons of England in 2012, states the following regarding steroid injections. Steroid injections are often effective in the short term, although they have been shown to cause fat pad atrophy, and very occasionally they may precipitate rupture of the plantar fascia. In one case series of 6 athletes with rupture of the plantar fascia noted, 5 had previously received steroid injection. Fat pad atrophy is a serious problem. Steroids unfortunately damage soft tissue. The fat pad underneath the heel provides cushioning to the heel. The image on the right shows how the fat pad has been destroyed following steroid injection. When the fat pad is destroyed, there is no more cushioning for the heel bone, and the pain can become much more severe and more difficult to treat. Surgery and release of the plantar fascia is another modality of treatment. This involves making a small incision and releasing the plantar fascia at the inflamed area. The spring ligament has a purpose. Releasing too much of the ligament can cause further stress on the foot. Hence, surgery is not without its potential complications. The previously quoted review by Kutz and co-workers states less than 50% of the plantar fascia is sectioned. Any more than this risk secondary collapse of the longitudinal arch and the lateral sided foot pain. Cadaveric studies have reproduced the lateral column overload that can follow from this. This shows that if the release is not finite, then the strain is transferred to the outer aspect of the foot. To begin with, pain was on the inner aspect, but with surgery, pain may shift to the outer aspect. A simple and non-interventional treatment is with orthotics. Orthotics are shaped according to the foot and provide appropriate support to the arches. At the rear is the cup to contain the heel. In the mid part is the built-up area to buttress the inner arch. Together, all this cradles the entire foot and provides the much needed rest to the plantar fascia. The symptoms of plantar fasciitis then resolve spontaneously. Let me quote from an interesting review by Lewis and co-workers. They state, orthotics, customized or prefabricated, have been shown to improve pain and function within 1 to 3 months with little or no risk. I would also like to present you with the findings of another Cochrane review by Crawford and Thomas. This is slightly old and has since been withdrawn. However, it contains very valid and relevant findings. They showed that the symptoms in 90% of the patients with plantar fasciitis would resolve naturally without any intervention. If that is the truth, if that is the natural history, then why have a painful injection or operation? Plantar fasciitis can be very painful and symptom relief is important. However, it is reasonable to choose a treatment that is least interventional and causing least complications. The evidence presented shows that injections and surgery may not provide all the necessary benefit and there are increased chances for complications. However, prefabricated orthotics are cost-effective and provide long-term relief with minimal adverse effects. There are a wide range of orthotics available at atrex.com. In addition, there are also flips, which are casual footwear with an inbuilt arch. I thank you for your attention.